Thank you so much for joining us today, Amanda. And I've got a little bio that I'm going to read about Amanda here. So she graduated in the spring of 2019 from, was it with a master's degree in communication and learning disorders from Our Lady of the Lake University. So she currently works full-time as a speech language pathologist at an
Mm,
elementary school in San Antonio.
neato.
And she works part-time as a speech language pathologist at a private clinic, also in San Antonio, Texas. Amanda provides services to infants, to adults, to young adults. She conducts assessments to evaluate communication and swallowing abilities. These assessments help identify speech and language weaknesses. After a plan is developed, Amanda then provides speech and language therapy to these clients. So, if you can, click on the little reaction button down at the bottom center of your screen. If you're able to turn your camera on, we would love to see your face. Otherwise, please remember to keep yourself muted when you're not speaking. And welcome, Amanda. We're excited to hear all about what you do.
Hi, good morning, everyone. Thank you for having me. I appreciate it. So as a speech language pathologist, you can work in a lot of different settings. One specifically is the schools, which I know that's a setting that you guys help kids with their reading skills. Another setting is the hospital, and then you can also work as a speech language pathologist in the NICU, home health, early childhood intervention. You can also work in some outpatient rehabs, some skilled nursing facilities. You can work at a university and you can work at a private clinic. Like she had mentioned, I do work full time at a school, and then I also work part time at a private clinic. In the school setting, if you go to the next two slides after that one, in the school setting, there's 6 different areas that you can qualify to receive services from a speech language pathologist. One is articulation, and that's how you produce your sounds. Different sounds are developed at different stages. So at a different age, it's developmentally appropriate to not be able to say a certain sound, but after that age, then it's no longer developmentally appropriate. So we offer services to help a student produce that sound. The next area that you can qualify with a speech impairment in the school setting is receptive language. Then we have expressive language, pragmatic social skills, voice, and fluency. If you go to the next one, it kind of breaks it up a little bit. The first one was articulation, which I had mentioned at the beginning there. That's how you produce your sounds. The next one that you can qualify is voice. This isn't as common in the school setting. It's more common outside of the school setting where you see it. Here we look at the quality, the pitch, and the intensity. Is it appropriate when compared to other peers of that same gender? Another area that you can qualify is fluency. So this is stuttering. So here we provide services to help a student who has a fluency impairment. If you go to the next one, in the school setting that you'll work at, if you go to the next slide, there you go. Receptive language. And this right here is something that you may see specifically when you're helping them with their reading skills. It's the ability to understand and comprehend what they're hearing. So following directions, answering questions, so specifically those WH questions, those yes no questions, and then listening comprehension, baby being able to comprehend what they're reading. The next area that we provide services is expressive language. So that ability to verbally express yourself. Here using not just one word, but an actual sentence that is grammatically correct when you're talking to others. And then lastly, those pragmatic and social skills. So these skills are is the interaction that we have with others, that those eye contact, taking those conversational turns, not being in their bubble, responding to those WH questions and those yes no questions, responding to greetings, and being able to tell a sequence of events, being able to tell a story. If you go to the next slide, here are you on the, sorry, I can't tell what you're on there. I think that's your last slide that I gave you. In the school setting with specifically, how does communication relate to their educational need? So being able to understand their speech. So specifically those articulation skills, being able to produce all those sounds. When you're teaching them ways or helping them with their reading skills, if they're not able to produce that sound, that word may not sound. Um, it might sound like they're not able to read that word, but it's that they can't say that sound. Specifically, speaking, writing, using grammatically correct sentences, understanding what they're listening or what they're reading. Language and reading and writing goes hand in hand. So children with a history of a language disorder are at risk for literacy difficulties. So this is where you guys come in and helping them with their literacy skills, with their reading skills. Um, do you guys have any questions so far?
I have one question. When dealing with like toddlers, at what age should they definitely be starting to talk? And if they're not, you could probably recognize there's a problem.
So babbling starts at at infant's age. They should be able to be talking in like phrases and short sentences at like age 3, like young. If they're not, then there may be a reason for that. Um, do you deal with a lot of toddlers at the school or is it mostly elementary school?
I deal mostly elementary school, but I have a nephew that's 3 and barely talking, and I'm going, there's something not right. And the mother, of course, is in denial. So
Yeah. So you can always, I don't know what the rules are in Arizona. In Texas, we actually, if they're 3 years old, at age 3, you can get an assessment at the school for free. And then services are provided if you qualify for services. So it's something that I don't know what it is and what the regulations are in Arizona, but it's something that you can contact your um, the school that you're zoned for to see if they provide any services for 3-year-olds. Something that if you are helping a student who qualifies with a fluency disorder, so stuttering, if you're helping a student um, with their reading skills, specifically with a fluency impairment, something that can help with that is just reminding them to take a breath because stuttering is um, it's a neurological disorder. So when your nervous system, when you take that breath, it changes your nervous system and helps you relax, and then helps all those muscles that shape that air that's in your mouth to create that sound relax, and the tension is decreased. So if you're helping a student who has a fluency disorder, that could be something that could help you when you're helping them is just, okay, let's pause, let's take a breath, and keep on talking. um, in regards to if someone has an articulation disorder, so they're struggling with a specific sounds, something that you could do is just giving them that verbal cue, that verbal model of how to say that word. Does anybody else have any other questions
Could you provide example of that?
of a verbal cue?
Yeah.
Yeah, so if you're helping like a 5-year-old and they're reading a passage about a king and queen, a lot of times someone who's struggling with that K sound, a typical um, substitution is like T for K. So they're saying teen instead of king. So you're like, oh, it's not a teen, it's a king. So and saying, "Do you hear the difference? Let's try that again. It's a king," and over exaggerate that. So that's something that you could do is just over exaggerate that initial sound, that k, that king. If they're struggling with the S sound, or if they're saying B for V, which is a typical substitution of sounds. So they're saying ban, but it's a van. And you're like, hey, hang on, it's not a ban, it's a van. And over exaggerate that first sound. You could provide a visual cue by just showing them your mouth when you're talking. So that way they're like, oh, okay, I'm putting my lips together for the B sound, but it's actually I'm supposed to be putting my top teeth on my bottom lip for the V sounds instead of B. So it can change how you talk. It becomes a habit. So they're not thinking of what they're doing. It's just they're talking, but it is changing the message by them not saying that sound correctly, which then transitions to when they're writing about what they read, they are writing how they're saying it because they're starting to sound out that word, and then they're writing it incorrectly as well. So once they get used to saying it the right way, then they'll be able to read more fluently, but then also be able to write it correctly.
Thank you for that. We have
Yeah.
another question in the chat from Val. She's asking, when it takes a child a long time to express their sentence, is that normal at the second grade level?
Do you mean where is it like a stuttering thing where the air is almost getting stuck in their mouth, like it's a block?
No, to me, it's more like they're concentrating on what they have to say and they can't pick out the words to say it.
But they're reading the words, or they're just trying to say it, like they're trying to explain it.
Yeah, if they're, explaining about their day or something like that, and they're, I don't know if they're just thinking of something else as they're trying to say it, but it takes them a long time to get out their message that they want to say.
It could be a lot of different factors. If there's like an underlining like ADHD type of thing and they're just focused on something different. Um, if they're taking a long time to say something, but it's grammatically correct and there's no like um where it's a repetition of a specific sound or a repetition of a word or a phrase, then it could just be they're just not focused on something, or it might be something different than a speech impairment type of thing. Now, if they're repeating uh, a, the initial sound multiple times, or if it's actually where like you can see that it's trying to come out, but the air is stuck, that's called a block. So that could be something to do with a fluency impairment. Um, but that specifically, if they're just thinking about it, it could be like an auditory processing thing, but that's something different. That would be something that like a school psychologist would look at, like a learning disability or type of thing.
Val says thank you in the chat. I have a question kind of in the learning disabilities realm. We watched a presentation a few weeks ago all about dyslexia, and we learned a lot about dyslexia. Is that related to your work, or is that a separate issue that needs to be addressed completely different, or is there kind of some overlap with a speech pathologist?
There's not an overlap with that. That is more of like the school psychologist area. Um, it is typical for certain like substitutions or reversals after a certain age, then it's not typical, but that's not what a speech language pathologist would provide services for.
And then
Now it is difficult. I've had students where um, parents are requesting testing for dyslexia, um, but if that student does qualify in the area of articulation,
Mhm.
we do tell the school psychologist, like, hey, this is a typical substitution for their speech. like this sound sounds like this, or this sound sounds like this. So when you're doing their assessment, they know, okay, that's why they sound like that. Not dyslexia, it's an articulation type of thing. So it is something that we do talk to them about if we have that child on our caseload.
Do you work? Sorry, and if volunteers, if you have a question, please raise your hand or take yourself off mute because I think this is just fascinating. So I'm sorry that I'm asking all the questions right
No, you're
now.
good.
But do you work with children who are bilingual?
I'm not a bilingual speech language pathologist. Specifically, where I work, we have Spanish speaking speech language pathologists. But we also have other students who aren't Spanish speaking who do qualify with a speech impairment, but it's a different language. But all the services that I provide are in English. Um, when a student is bilingual and they are evaluated, uh, typically, if the SLP does not speak their home language, then they will research that language to see what should be developed by that age and test them in both languages. So you may have say like a Spanish speaking kid, and they'll be tested in Spanish, but they'll also be tested in English. And if there's a deficiency, like atypical things that they are doing, that it should be developed by that age in Spanish, then they won't qualify for services. And it's just that they're learning English. I explained that really poorly. um, but I specifically don't provide services only in another language other than English.
No, I hear what you're saying. It's like they're just kind of gauging like, is it the same sounds even in a different language they're struggling with?
That should be
Yeah.
developed by that age, yes.
Gotcha. Are there still, would you still use the same tools if you have a student who is bilingual and they're not being evaluated and you're just, working with them on how to read? Because a lot of our foster grandparents and even our grandparents here, who aren't in the foster grandparent program but might have grandchildren at home, they might not be working on really academic material all the time, but they might be sitting down with a student and helping them with their homework or practice reading with them. Are there tools for English only students and bilingual students that our volunteers could use or that you would encourage maybe they're doing already and they could do more of?
Yeah, so definitely those verbal models, like I had mentioned, retelling, always you can practice retelling a story in many different ways. Even just retelling the story of your day. So, oh, what'd you do today? And if the student starts talking about, oh, I ate breakfast and then I went to bed. And you're like, whoa, hang on, you missed a whole lot of things there. Tell me three things that you did today, or four things. Or if they said, I had cereal, okay, how did you make that cereal? So see if they can tell you the 3 or 4 steps of how to make cereal. So it's like telling you a sequence of events, which then relates to telling someone the sequence of a story type of thing. Um, Explaining what a WH question is, because a lot of when after you read a story, that's what's asked is who's in the story. Okay, well, what is a who question? A who question is a answers a person or an animal type of thing, or well, what's a where question? Where's the place? Like, where did it happen? Did it happen at a park or at a house? Or what's a when question? So explaining what those WH questions are, because a lot of students who struggle with those receptive language skills struggle with understanding the difference of those WH questions. So just reminding them what they are. So what's a what questions? Well, a what question could be an action or an object, like what are you doing? They're running, or what did they have on their feet? Shoes, type of thing. So explain to them what it is, what the WH question is. So that could be something that you do. If they need to read the story again, telling them, hey, it's okay, like, let's read it again. So see if you can understand it then. Just, reinforcing that it's okay, like, that we read it again.
Excellent. Thank you.
Are there any other questions?
You mentioned swallowing.
Yes.
What is the importance of swallowing when it comes to all the speech?
So when we swallow, we use the same muscles that we use for speech. So we're using that tongue, the teeth, the lips, the hard palate, all the muscles that we're using to create that air in our mouth to let it out and create the sound that we hear are the same muscles that we use for swallowing. In the school setting, um, at least in Texas, I don't provide services for swallowing disorders. The occupational therapist does. I do work with them for safety to make sure that the students are the texture of their foods, that it's safe for them to eat if they do have a swallowing disorder. A lot of times we'll work on oral motor exercises to work on that strength ability with those muscles. Um, that way, so a lot of times, if say you have a kiddo who has a tongue tie, well, not only are they not able to lift their tongue up to push back that food and swallow it safely, they're also not able then to lift their tongue up to produce their certain sounds. Because when we lift our tongue up to the top of our mouth, right behind our teeth, that's how we produce that L sound. Or if we lift our tongue up and back, that's how we produce those K's and G sounds. If we lift it up, it's also how we produce that R sound. So if we're not able to move all those muscles, and if we don't have that strength and that coordination of those muscles, then it will not only interfere with our ability to talk, but it also interferes with our ability to swallow safely, to where we're not choking on that food, to where we're not aspirating and having it go down, our trachea into our lungs versus down our esophagus to our stomach. So that's how swallowing would be targeted at, like, in the NICU, or at a hospital setting or an outside clinic. In the school setting, we don't do a lot of swallowing therapy.
Very interesting.
Is that something that you would see potentially even with older groups then? Like maybe somebody that had a stroke or had like another medical
Yes.
situation potentially?
Yeah. So with stroke, you would see a lot of swallowing, but then also you would see also, depending on where the bleed was of their brain, on what area, it can interfere with their expressive language or their receptive language. Um, in regards to, um, oh, sorry, I'm getting all these. I don't know if it's the chats or something's popping up on my phone. But yes, you would see the swallowing part with a stroke. Does anybody else have any other questions?
No, I think everyone is choosing not to speak.
Going back to bilingual, if it's a sound that their home language doesn't have, so the they may not have that sound, so it might be the reason why they're not producing is because that sound isn't in their home language. Going back to someone had asked a question in regards to a toddler not talking yet. Typically by age 3 to 4, um, they should be talking, phrases, sentences, but their speech should also be about 80% intelligible. So meaning you should be able to understand them. So I would definitely recommend contacting the school that you're zoned for to see if they offer that those type of assessments, speech language assessment, if you have concerns.
So you said 80% by what age?
By age 3,
By
yeah.
age 3.
2 to 3, it's typically about, anywhere from 50 to 70% intelligible. Um, you, the sounds are different. They developed at different ages. By age 3, it is typical to still struggle with that R sound. Ours developed by age 5 years and 7 months. Um, the TH is also a later developing sound, but early developing sounds are those sounds that we see visually. So those P's, the B's, the M's, the F's, K's and G's are early developing. But later on is that R and TH. So at, toddler age, it is typical, but as, they get older, it is typical, or it becomes atypical. By age 3, they should be able to answer simple WH questions. They should be able to understand some spatial concepts, so on, off, in, out. They should be able to understand some temporal concepts, so like first, then last. They should be able to, relate to simple experiences, but they should also have about 1,000 words in vocabulary. So if they're not talking a whole bunch, that's, it could just be that they just need some extra help.
Amanda, what's your day-to-day routine like? Like, about how many children are you working with? What kinds of, what age groups mainly do you work with? And are you going back and forth between the school and the clinic every day?
Not ever. I don't go back and forth to the clinic every day. And the school that I work at an elementary school. So I do see those toddlers that come in. Some of those toddlers are part of our early childhood classrooms. So starting at age 3, but I also have drop-in kiddos that don't have the need for anything other than just speech. So they'll come in for 30 minutes once a week for speech therapy, and then they go straight home. Um, at the elementary school that I work at, it's from that age 3 all the way up to 5th grade. The school I work at is pretty big. Typically, you like to have only 55 on your caseload. Um, I had almost 100 on my caseload. And so what I do is I provide services. Usually they're in groups because of the number of kids on my caseload. But then also I am part of meetings to help with their educational plans. So they call them ARD meetings, admission review dismissal meetings. And then I also do assessments on top of that for all those kiddos, whether it's an assessment to see if there's a disability, but then also with us, we have to do an assessment to dismiss. So once they graduate from services, so then you do that assessment, but then it's also report writing. of that assessment. Um, at the clinic that I work at, that clinic services from infants to young adults, so about age 20 to 21. The clinic that I work at, they do more of the swallowing, and you see more. I don't have any on my caseload right now, but you do see more of those voice issues. So I see something popped up with a question, but I wasn't able to read it.
The question comes from Val. She's asking, so when you work in groups, do you find the kids learn faster with the other kids, or is it less helpful?
In my opinion, it's less helpful. There's more distractions. So they're talking with their friends or looking around. They're trying to be funny. Um, then on top of that, it's less time working on their specific goal. If you're able to have a group of everybody's working on that same sound, then that's awesome. And you play a game, you work on that sound. But I've seen a lot of progress. If it's specifically articulation, so how you're producing your sounds, I've seen a lot of progress where you pull the kid out literally for 5 minutes, 3 days a week. You drill that sound over 100 times, and they go straight back to class. So it's less time out of the classroom. Um, in groups, um, it, I feel it is better individually, um, just because you have that one-on-one time and you're working more on a specific goal versus, yeah, you pulled them for 30 minutes out of their classroom, but you actually only worked with them maybe 6 minutes because you have to work with everybody in that group. So they might be, working with a partner, or they might be, coloring a craft that has their goal on that craft, but there is no direct instruction with them for that full 30 minutes. Are there any other questions regarding that?
I have a question for again one after like an adult. If an adult already had, let's say, quote unquote, perfect speech, and then something medically happens to them, and then they have to relearn speech or you know, swallowing, what it may be. Would it be a speech language pathologist again, that works with them, but obviously in a different setting? And then is it something that they maybe because you work with kiddos, you may not totally know the answer, but is it something that they can regain? Is it
It's something that they can
okay?
regain. Yeah, a lot of times they'll work on strategies, whether it be like a cue. I've had clients where I've taught them, okay, you're trying to, when you have a brain fart type of thing, you're trying to think of the word. Um, why don't you move your finger and start to do the first sound until it comes to you? Or um, in regards to like the swallowing part, that's kind of tricky because if it's not safe for them to eat a certain texture, then you're not going to have them eat that like harder. If it's not safe for them to have a liquid, they need to have a thicker texture. Um, they can depend once they regain that strength, they can go back to eating, but it's if there's other health issues, they may not. But that would be a speech language pathologist, but typically those are in like either a hospital or a sniff setting or a rehab setting.
And so for that swallowing, then sorry, I missed. Are you saying it is related to speech, or is it more just a speech pathologist helps with those muscles, but it's really related to more just like what's going to be safe for them to swallow food wise?
What's
It's not really for speech.
Yeah, not really for speech. So there are some that,
Oh.
have issues with the swallowing. So a lot of times what will happen is a speech language pathologist will go do either a video test. So I've seen it where a van actually goes outside of a nursing home and you go in and you do it's a video test. So you can either do it with a scope where the video goes just inside your mouth, or you can do it where they are covered safely and it's just an x-ray almost type of thing. So there's no scope that goes in their mouth. So then you watch, okay, was the liquid held anywhere in their mouth, or was the food held? Was there did everything get swallowed the first time, or was there residue anywhere pocketed on their tongue or on the sides? Where did that food or liquid go? Did it go in their trachea, which leads to their lungs, which is when they aspirate it, or did it actually go into their stomach? Because if it goes into the stomach, they're good. But if it goes in their trachea into their lungs, that's when you have pneumonia and then they get sick and everything.
Thank you. I didn't realize that the speech pathologist did that and it was separate from actual speech. So, yeah, they do wear a lot of hats.
Yeah. So a lot of times what will happen is like if a person has like a motorcycle accident or some type of accident, a speech language pathologist will always be part of that team that goes and checks out the patient at the hospital to make sure they're safe to swallow. So they'll do like a bedside swallowing exam. And if there's any red flags of aspiration, which could be like a tear going down their cheek, any type of grimness on their face, or coughing, that's a sign of aspiration. So then they would request that an actual test be done, not just that bedside swallowing test, before they get the okay that they can either drink or eat. Um,
So I know you probably can't divulge a lot of information or any information about kiddos you work with, but do you have a couple of favorite stories by any chance of kiddos you
um,
work with maybe
as
overcoming or
So I have worked with the it's similar to what you guys do. It's San Antonio Youth Learning. It's called SAIL. I would volunteer and help with kiddos in schools that are lower economic areas and help with them with their reading skills. Something that I would do, I would go with a group of other SLPs and volunteer with that. We would separate them into groups. I don't know if you guys are more like one-on-one with helping them or if it's separated into groups. We would do both. And when we would separate them into groups, we would work on different levels of a specific story. But before we started working on that story, we would review, okay, what is a what question? What is a who question? What is a where questions? All those questions, we would also give them the verbal cue, like, okay, it's time to listen now, type of thing. A lot of it was reading and then them understanding what you were reading to them. Now, when they were pulled individually, it was them reading to us. So that's where you would uh, have issues with understanding their speech if they were struggling with a specific sound or if they had that stuttering type of thing. Um, but in regards to stories, kids are funny. um, but Uh, they are funny. Do you have any other questions? Or does anybody have any um, thing they would like to say or?
I have one thing. I deal mostly fourth graders, and not a lot of them, but some of them go to speech therapy. Is that similar to what you speech therapy? Kind of the same thing?
Yeah.
And it's kind of frustrating to me just as an outsider, not as a parent, but working with these kids, they'll get exited out of the program and they'll still, to me, sound like they have the same speech problems as when they went in. And to me, it's kind of frustrating. It's like, well, why are you exiting them when their speech is still messed up?
Yeah. So it is frustrating. I have seen high schoolers struggle with the R sounds. But when they're with me or they're with it, when they're not in conversation and they're not outside of the speech room, they may sound completely different. It may also be an issue where they just don't care that they're saying the sound incorrectly. Um, that's when you call them out on it and say, all right, you're in fourth grade and this is what I'm hearing, but this is what it's supposed to be. Um, Depending on the fourth grader's personality or that kiddo's personality, you may have to word a little bit differently so you don't hurt their feelings and have them shut down. Um, but I've also seen it to where, yes, the kid still struggles. However, if there's another area of concern, they are performing with an average. So if I've seen it to where, say, a kid has a specific learning disability, so specifically in reading, there are some tests that you can look at a targeted population. What was the average of of kids with a specific learning disability? This was their score. Then you go test that kid who has a speech language impairment. You test them and they score higher than that group, but they have a specific learning disability. If they score higher, it's still below average, but it's higher than that group. There's no need to pull them from services because they're getting academic help from like a collaborative teacher. So they wouldn't qualify anymore. They may still be below average with their same peers of their same age peers, but they're above average with kids who have a specific learning disability or kids who have autism or kids who have um, another specific disorder. They're above that. There are only specific tests that have that targeted population where they've done that pull from that to get that. So I 100% understand your frustration because I see that as well. So it could be a couple different things. It could be, they're scoring higher than that target population of what their impairment is. Um, but it could also be they just don't care. So we can only document what we see in the room with no one else around. We can't, be there 100% of the time.
Thank you. Amanda, what motivated you to study and become a speech pathologist?
So I actually used to live in Phoenix. I grew up in Phoenix and I worked at a movement disorder clinic there at Mayo. And a lot of the patients we would see there had Parkinson's, and we would refer them to a speech language pathologist. And I was like, hey, that's actually kind of cool. Why are we doing that? And so then that's what motivated me. but I did that a long time ago.
Very cool. Awesome. We have another question in the chat from Brenda. She asks, can you talk about stuttering and how you work to solve that with the kiddos?
Okay. So stuttering's a lifelong thing. It's not something that they will graduate from speech from. But the severity will change. Meaning a student or a kiddo may go a long time without having any stuttering, and then all of a sudden they're stuttering all of the time. So a lot of different influences on that. It can be their stress levels, because stuttering is a nervous system disorder, meaning it's not going to go away. Speech therapy for stuttering actually targets and helps with them getting through that stutter, not actually having that stutter go away. So we focus on teaching strategies of helping them stutter easier, if that makes sense. Really, the biggest thing that you can do is to help them accept it, but then to remind them to take a breath and to slow down, because when you take that breath, that literally changes your nervous system and relax those muscles. Stuttering can be hereditary. It you're gonna it is you see it's a lot where they have a dad or a sibling that has that same disorder. You see it more in males than in females. Um, you do see it differently. You can also see a what is called a silent stutter. So people who stutter tend to learn what sound gives them the hardest time. So if you're trying to teach, or you're working with a kiddo who stutters and they're trying to read a passage and they see, I always stutter on S, and that word says slide. So they may just skip that word because they don't want to stutter. Or when they're talking in conversation, they may change the word. So if they always stutter on that B sound and the word is bus, then they may change the word to car instead of saying bus. So that way it's more fluent and they don't stutter. There's less when someone is reading and they're stuttering, a person who stutters and they're reading, there's less pressure because they're not trying to have to think of that word. A lot of times they will do like just skip it over or try to describe something instead of actually saying that word. So then that way they don't stutter. So with speech therapy, we try to teach them to accept it. So part of it is counseling, but then, part of that counseling part is, there are these people who are actors or actresses or famous athletes or whoever, famous people who also stutter. So help them realize that it's not just them, but then also it's okay. Like we we all stutter. We all get nervous or excited or sad or upset and then start to say something more than once. So we say what is called fillers. So a bunch of like A's, like A, or like every other word, saying the word like, or saying the word the sound every other word. Those are fillers. That's we all do that, but when you do it so many times where it interferes with the message being sent, that's when it becomes an issue. I hope that answered that person's question.
Yeah, I think that was a great answer. Thank you. Anita wanted to make the comment that famous actor James Earl Jones was also a stutterer. So thank you, Anita. And then Val had a question kind of in the similar vein, but more about lisps. How do you work with kids with lisps and how do you address that?
So it depends on what type of lisp it is. So if it's a frontal lisp where that tongue is going out in front of their teeth, um, it's a lot of verbal cues of, hey, we got to keep that tongue back. So you need to close your teeth. We want to make sure that they're not going around in their lips, because once you round those lips, it changes that S to the SH. You want to tell them to spread it out like a smile. So you want to close your teeth and kind of smile, and then you blow that air out. Now, if it's a what is called a lateral lisp, so that air, instead of going out through the front for the sound, but it's escaping out through the side, and it almost sounds kind of slushy in a way, like that. Um, then we work on actually working on the T sound first. That's what I do. See, okay, do you have a good T? And then we transition that T to an S. So then that air is going out through the front and sounding like a really good S sound. Um, you also want to make sure it's not something with their like if they have an open bite, or if they're something with their teeth from like sucking their thumb, or some type of oral structure. So if it's a structure thing, then it's not appropriate to work on the sounds. If it's not a structure thing, then it's okay. So I have had one kiddo who she had cerebral palsy, or has that cerebral palsy, um, but she also has a very open bite, and she can keep her tongue back, but every now and then, because of that open bite, her tongue goes forward. But I did not keep her on the queso to pull her for an S sound, because that was the only sound she was working on, S and Z, and it just wasn't appropriate because of the structure of her mouth. Now, if that gets fixed and it still is an issue, then it would be ethically appropriate. But just giving those kiddos a verbal cue of, hey, we need to spread our lips almost like we're smiling, and closing our teeth to keep that tongue back, and then blow the air out.
Hello,
So,
it's Gloria Davis. I got a statement and I also got a comment. My brother was born with his palate was connected, and they had to cut it. They called it what, tied tongue back in the day, where he wouldn't couldn't hardly pronounce his words and stuff, and they had to cut his palate in order for him to be able to move his tongue in order to form words when he was a little boy. But I'm just glad you said this. I, you made a statement about the kid just might be kind of lazy by not, trying to form words and stuff. My daughter is adopting a child. She's 2 years old. Now, they just finding out he is in daycare, but they just finding out that he got some sort of autism. But I think he's a very intelligent child because he do find ways to communicate, and it's not verbal. It's verbal. Most of the time he would cry for everything that he wanted instead of just telling you, and she be constantly, this is good information for me to share with her. And telling, she always said, well, tell me what you want. What do you want? What do you want? You know what I'm saying? And he will not, he refused to say anything, for us. I want my car. I want something, I want to
Mm-hmm.
eat or whatever. But I don't think it's just the autism. I think he's just lazy because he's very intelligent. When he wants something, oh, he find a way to communicate and tell you what he wants now.
So
That's why
something
I
that
feel that.
might help with that kiddo are pictures, because those big pictures will become his voice. You can get pictures. It's like a picture exchange communication system. So if he's not verbalizing like with his words, like goldfish or fruit snacks, and that's what he wants, you can use pictures. Like he can hand you a picture of goldfish to alleviate any frustration. A lot of kiddos with autism, I've seen it to where they are extremely intelligent, like you had mentioned, but they're nonverbal. That's when you introduce those pictures, and those pictures become their words. So you can, and that can be a wide range of tech. So you have an actual picture. I don't have any right in front of me, like a picture card, or it can be pictures on their on like almost like an iPad that they push, and it will say the word for them. Um, that alleviates a lot of frustration for them, but then also for the adults, because, you know, it's way easier for us to give our kid, just to give our kid their snack or their juice or the toy that they want, than to force them to, like, hey, just tell me what you want. But if you're introduced to them that, hey, this picture of a fruit snack means fruit snack. So if you want this fruit snack, give me this picture, type of thing, and then give it to them. Then we expand it to where it's not just the fruit snack, it's a picture of someone pointing to themselves. So it's saying I, and then someone saying, um, holding out their hands for like a want picture, and then they point to I want, and then that, so that increases their utterance. So those pictures, or those pushing of the button to have it be read out loud, becomes their voice. I've seen it to where eventually then they start talking to you, but I've also seen it where they just stay nonverbal, and that device then becomes their voice.
Now that's a good thing. I'm gonna share that information with her. But they do have it's a grandbaby in the household too, and she's seemed to have the same issue going on with her. But they got an iPad and the television. There's some lady on TV that they love to watch,
Mhm.
and they will count everything one, two,
Yeah.
and things like that. But they will not be verbal with us.
Yeah.
But they will, try to communicate, back and forth, laugh, talk, whatever she may say. They may repeat it. They may try anyway. But yeah, I will give her that information though.
And
Thank
that's
you for this
also
information.
it's called PECS. You can look online, PECS. That's an autism learning material website. But that is also something that I like I said, I don't know how Arizona is in regards to like their schools, to where what they provide for kiddos who are not actually school age yet. But if they were in Texas, what we would actually suggest is early childhood intervention, so ECI. So anywhere from infant to 3 years, an SLP would go, provide services to help them. Or if their age is 3 up until right before kinder, that's when you have a confined classroom. So it's a classroom that is smaller than a typical classroom, but they have special education teachers in that classroom that help those students with it's very visual, very there's pictures everywhere. And I've had some classrooms where they have what is called like a Big Mac, and they have a big button for specific words, and that becomes the student's voice. But for kiddos who are struggling more at that age, with this in the schools here, um, services are provided. They may be in a half day program or a full day program, depending on the severity, but they are provided. So I would definitely reach out to the school that they're zoned for and ask what's provided.
Thank you so much, Amanda.
Yeah, of course.
All right. Anita in
All
the
three
chat.
of my boys had speech. Just, I know Amanda was talking about San Antonio, so just heads up for at least Maricopa. All three of my boys had speech from 3 years old. Two of them graduated before kindergarten. The other one had it through kindergarten. So it is there. It's here too.
Thanks. In the chat, Anita said that she likes to draw pictures as cues for her kiddos to remember certain words, especially when rhyming. For example, house, mouse, etc. Oh, Amanda, you're muted.
Oh yeah, and it's fun because I will draw the picture and I'll ask them, can you tell me what this looks like? And then I'll write the word next to that picture. And then there's the mouse. I'll draw a silly mouse, or we talking different other words that I can draw a picture. And it's fun when they recognize what I'm trying to show them, and so we get a giggle out of it. But we're learning too. So.
Thank you. And Amanda actually has another appointment. So if there aren't any other questions, if we can let her know how much we appreciated her coming and taking some time out today and letting us know a little bit more about what she does and how we can help our students that we're working with.
Yeah, it was nice to meet everybody. And if anybody has any questions, feel free to, let Hope know and she can reach out to me. And I'm more than happy to provide any answers and or try to guide you into any services. Again, that picture thing is called PACS, and that's something definitely. There's some free materials on there that could help.
But where?
Thank you.
All right, thank you. It was nice to meet you all.